KCTV5 News stands for you.
A surprising amount of deaths could happen in the nation's COVID hotspots. That's the warning tonight from a doctor at George Washington University. Thanks for joining us. I'm Brad Stevens. Carolyn has the night off. One of the specific hotspots being mentioned right now is Missouri. Hospitals in Springfield are running out of room. Mercy Hospital had to open a 6th COVID ward. That's the most it's had during the entire pandemic. The leader at Cox Medical tweeted some numbers. 119 COVID inpatients right now as compared to just 14 patients in the middle of May. Projections for next week range from 153 to 178. Steve Edwards tweeted, "This is likely well beyond our capability." KCTV5 investigative reporter Angie Racono is monitoring the spread of the Delta variant across the state.
We spent the day checking in with other communities who are a few weeks behind where Springfield is, and they also have seen that rapid uptick in cases. So this is the Freeman Health System. You can see on June 1st, they had 13 patients, and today they actually had more than 50 patients. In this time frame, 23 deaths.
What took us by surprise was just how quickly the variant strain became so heavy in this area.
Jessica Liberty is the infection prevention manager at Freeman Health.
Okay, you ready?
She finally took a break over the weekend, and the patient load inside the hospital changed again.
We were in the, I would say probably low 40s when I left on Thursday, and now we're in the 50s.
Patients look different than the first wave, which was mostly older patients who struggled with respiratory problems. Delta variant patients are younger, in their 30s and 40s, and mostly unvaccinated, and they are miserable.
What are you seeing that's different with the symptoms?
So we've seen a lot of people present with gastrointestinal issues, nausea, vomiting, diarrhea, abdominal pain, appetite loss.
New patients are no longer reporting they are losing their taste and smell. Many don't have a fever. Some don't even cough, but all are very sick.
How does this compare to like a month ago?
Oh my goodness. It has just steadily, the numbers have steadily gone up.
Columbia, Missouri is seeing rising numbers too. It has the best vaccination rate in the state, but the hospital serves 23 counties, and many other counties have low vaccination rates. So the hospital is treating a new wave of younger, unvaccinated patients.
It's pretty disappointing in all honesty.
Staff is exhausted.
It hurts.
Doctors and nurses felt relief when vaccines were released. The end was in sight, but COVID had other plans, and variants had some help.
The staff are frustrated and disappointed with the lack of people getting vaccinated.
Hospitals in both Columbia and Joplin are looking at the positivity rate and rising case numbers, strong indicators this second wave hasn't crested yet. We are keeping a close eye on the situation in Springfield, which is projected to get worse. Microbiologists monitoring the wastewater say they can tell that this is actually moving from rural to large cities. We've been checking on the numbers in our area, and so far we aren't seeing the massive increases like Columbia, Joplin, or Springfield. But the CEO of Cox Medical tweeted out this sad warning. In about 4 weeks, the better part of our state may be in a similar position. He goes on to say, if you could see the exhaustion in the eyes of our nurses who keep zipping up body bags. He's been making the constant point that people need to get vaccinated or take measures to protect themselves. Angie Racono, KCTV5 News.